In the Canadian Physiotherapy Association, the public are served by practicing physiotherapists and experienced physiotherapist board members, ensuring quality services are provided and that care is always patient-centered. These are their stories.
You know what makes me a good PT detective? I'm very stern.
That was okay there, Kendra. That was humorous.
Let's take a look at the crime scene. 1 week ago, on an icy, cold morning, Taylor Fibula was distracted while walking from 14th Street to the University of Saskatchewan. It was a sidewalk covered in fresh snow. Her right foot slid off the edge of the sidewalk and landed on the outside of her ankle bone. She felt a crack and immediately crumbled to the ground. It was painful to stand. She could only lightly featherweight bear the rest of the walk to class. She then sat through a 3-hour lecture, in which at one point she investigated her ankle due to the throbbing and aching pain and noticed that it had become gargantuan. She had to featherweight bear throughout the rest of the day without using any walking aids. By the end of the day, her ankle was so swollen you could say she had a cankle. It was excruciatingly painful, with local pain on the outside. It was very warm and too tender to touch. The following day, the swelling had not gone down. She continued to featherweight bear on the foot without an aid, doing her daily activities, like going to school, grocery shopping, and self-care. But she avoided prolonged walking, as well as heavier activities, like running or exercise. She decided it was time to visit a walk-in clinic, where she was diagnosed with a grade 2 ankle sprain of her anterior talofibular ligament and calcaneofibular ligament of the right ankle. You might ask, what's the big idea? Well, a grade 2 partial ligament rupture resulting in mild instability comprises 9.5% of all injuries. It is a common injury for a physio to see, as it can affect almost anyone, and it affects balance, proprioception, gait, and many more activities of daily living. It also predisposes individuals to future re-injury. Taylor was then smartly referred to a physiotherapist for treatment. This is our story. In previous files, it was found that Taylor had an ankle sprain 6 years ago on the same foot. She did not see a physio, but a doctor prescribed NSAIDs and said she had a quick, full recovery. She otherwise is on no medications and has had no previous surgeries. Clinical findings upon investigation of the ankle include tenderness on palpation to ATFL and CFL, swelling and warmth over the area with bruising beginning to appear, limited dorsiflexion and eversion, only about 50% of normal, pain limiting plantar flexion and inversion, an empty end feel at 30% of range. Pain is worse by the end of the day and tends to wake her up occasionally in the night. Manual muscle testing not performed due to the risk of irritation. She is unable to fully weight bear on the ankle, and she has a supinated foot evident in the wear pattern of her shoes. Full strength in back, knee, hip, and left lower extremity.
So in the past, when I had my ankle sprain, I didn't really do anything for it, and then it fixed itself. But then this time around, it wasn't getting better, and I tried looking online. So I found, I tried a yo-yo diet, and it didn't work. I tried some ginger, and that also didn't work. But then I tried coconut oil all over my ankle, and that still hasn't worked.
So, the physiotherapist educated Taylor regarding evidence-based practice protocols for her ankle sprain, including early, gentle, non-weight-bearing, passive and active assisted range of motion and stretch into dorsiflexion, plantar flexion, eversion and inversion. Writing the alphabet in the air is a great way to do this. Isometric exercises, meaning contraction of the muscles without producing any movement at the joint. And cross-education by continuing to strengthen the other leg and ankle will help in the future physiotherapy of the injured ankle sprain. Manual therapy, including grade 1 and 2 joint mobilizations, are also contributing to the overall physiotherapy experience. She was also educated on the importance of the Price principle to manage the inflammation of this healing stage, protect by preventing weight bearing and excessive stress on healing ligaments, rest, ice, compression, and elevation above the heart. In internal affairs, aka the CPA board, Taylor's physio, although it is evident she is a skilled physiotherapist, she failed to safely observe her clients in walking and in sitting, and was not consistently demonstrating professional behavior. She was stripped of her licensing for the time being.
Alright, so now that my ankle, I can actually walk on it now, it's not as ballooned out, I'm not in as much pain. What I'd really like to get back into is broomball. I haven't played since high school and I really do want to get back into it.
Okay, sweet. That gives us a lot to go from. So first off, while you're being able to walk on it, we want to restore something called proprioception, which is just a fancy word of being able to know where your ankle is in space and relative to your body. So we'll be doing lots of balance exercises for that, as well as we want to get that ankle as strong as your other ankle so you can do those things and play broomball as well. And then we really want to work on major exercises, which I will be showing you in a little bit for your strengths and overall fitness.
Okay, sounds good.
Okay.
I feel so much better after doing the physio for my ankle.
Great.
I can trust my ankle more. I feel like my balance is much better. I feel way more fit than I was before. But what I want to do moving on is that I want to be able to trust my ankle when I play broomball and just know that I'm not going to hurt it again.
Okay. So what kind of things do you have to do in broomball that you're worried about rolling it again?
Okay,
So
so
tell me some things that you're doing in
Sure.
your position.
So I play defense, and it's running on ice, so I need to be able to run no problem. Also, the way that you get grip is that because you're running on ice with special shoes, that doesn't mean that you always have grip at full time, so you can't stop on a dime. You need to be able to push off the boards and then get your momentum. And then it's a lot of running side to side, running up and back. And then the shooting I'm not so worried about because I've been keeping up with my just gym exercises for my upper body. So it's just making sure that my ankle is strong enough for it.
Okay. Okay, so we'll continue on with the broomball drills. and we'll keep progressing with that, and then your general lifting, so all of the lifts that we have, such as the deadlift, the squat, and we'll continue with the 85% of your 1 RM for about 6 reps or so, but making sure you have good form and technique.
Okay, great.